Pregnancy Week 2. During the second week of your menstrual cycle, your body shows signs of preparing for ovulation. If you have a 28-day menstrual cycle, ovulation usually occurs around day 14. At this time, you are technically not pregnant yet, but it's the time when you are most likely to conceive. It's important to note that sperm can survive up to 6 days in your reproductive system. Therefore, it is recommended to have regular sex throughout the second week of the menstrual cycle. Having sex 1 to 3 days before ovulation increases the chances of getting pregnant. Week 2 pregnancy, ovulation, symptoms. Mild cramping. You may feel mild cramps or a slight twinge of pain in your lower abdomen. Egg white cervical mucus. As you approach ovulation, your cervical mucus becomes thin, clear, and stringy, resembling egg whites. This consistency helps sperm travel towards the egg. Increased sex drive. It's common to have a higher libido during ovulation. You might feel naturally more interested in having sex for conception. Enhanced sense of smell. Hormonal changes can boost your ability to detect different scents, possibly to help you pick up on male pheromones for procreation. Rise in basal body temperature. During ovulation, your basal body temperature slightly increases. You are most fertile in the 2 days before this rise. Breast soreness or tenderness. Hormonal surges during ovulation may cause slight soreness in your breasts. Pelvic ache. You might feel a small twinge in one side of your abdomen as your ovary releases an egg. Light spotting. You may notice a small tinge of red or brown on your underwear around the time of ovulation. Vulva changes. Your labia, or the outer part of your genitalia, may swell. Week 2 pregnancy ultrasound. During the second week of pregnancy, an ultrasound is generally not necessary unless you are having difficulty conceiving or are worried about getting pregnant. In such cases, your doctor may perform an ultrasound to measure the thickness of your uterine lining and determine whether your follicle is maturing properly. Week 2 pregnancy belly. During the second week of pregnancy, the uterine lining thickens in preparation for a fertilized egg, but there won't be a noticeable baby bump. Week 2 pregnancy body changes. Every month, a woman's ovaries mature about 15 to 20 eggs, but only the ripest egg is released into the fallopian tube for fertilization. Fertilization happens when a sperm penetrates the egg, which takes approximately 24 hours. The fertilized egg, known as the zygote, divides into 16 cells and moves from the fallopian tube to the uterus. After 4 to 5 days of fertilization, it begins to embed into the blood-rich lining of the uterus. Around day 8, the placenta starts to grow. Week 2 size of the baby. Although there is no embryo, your body has already started preparing for pregnancy since week 1. During this time, your body shed its old uterine lining and expelled last month's unfertilized egg. Your due date will be calculated based on the first day of your last menstrual period. Week 2 pregnancy checklist. Keep track of your fertile window using a fertility tracking app or calendar to note your menstrual cycle start and end dates. Monitor your body for signs of ovulation such as changes in basal body temperature, cervical position, and cervical firmness. Consider using an ovulation test kit, which measures the levels of luteinizing hormone, LH, in your urine to confirm ovulation. Increase the frequency of intercourse as you approach your fertile period to maximize the chances of conception. Monitor your cervical mucus to track ovulation. Clear, slippery, and stretchy. Mucus indicates ovulation, helping identify your most fertile days. Week 2 pregnancy tips. Start taking prenatal vitamins before conceiving to ensure you have the necessary nutrients for a healthy pregnancy. It's important to reduce stress and get regular exercise to support your overall well-being during this crucial time. Avoid drinking alcohol as it can harm the baby's development. Quit smoking to reduce the risk of complications during pregnancy. Managing your weight and eating a well-balanced diet is essential for your health and the baby's development. Schedule a visit with your healthcare provider to discuss your pregnancy. Maintain a healthy lifestyle to support the growing baby. For more videos like this, please like, share and subscribe.